All right, welcome back, everybody. We are at the final session of day 2. We're pleased to have Emily Rose Finkle and Carrie Chanter out of Genesee County. Emily is a certified prevention specialist and has been working for the Genesee County Prevention Coalition since 2016. Emily facilitates the Underage Drinking Workgroup and is the lead staff on the Do Your Part, Be the Solution, Parents Create a Safe Space Toolkit. In addition to her work with the GCPC, Emily has volunteered with the Holly Area Community Coalition for more than 20 years. She is very passionate about substance abuse prevention and recovery and the challenges that youth face concerning substance use. Carrie Chanter joined the staff at Genesee Health System as a manager of co-occurring service integration in January 2018 and has a long history of experience in the public health sector, including training and education, corporate wellness, and emergency response. She has certifications as a Master Certified Health Education Specialist and a Certified Worksite Wellness Specialist. In her current role, she assesses and monitors the effectiveness of co-occurring services in Genesee County and is a liaison between mental health, physical health, and substance use disorder service providers and systems. Carrie received both her bachelor's and master's degree in the public health field from Central Michigan University. She serves on the board of the Genesee County Prevention Coalition. So welcome the two of you. We will turn it over to you guys. Thanks.
Thank you.
Okay, so I just wanted to go over a little bit of housekeeping. Please make sure, it looks like we're all muted anyway, so I don't think we have to worry too much about that. And we will be monitoring the chat box as far as raising hands go and different questions. I'll be trying to handle that and vice versa when Emily and I are both tag teaming this. So thank you. Next slide. You know what, Mike did such a nice job introducing us, but that's a picture of Emily and I at one of our events. You know, I love serving on the board, but really it's the staff of our coalition that does amazing things. So I was really happy to be invited to kind of co-present with Emily, but really they're the experts on what we're doing. So next slide, please. Just the first couple of slides we have, I just want to bring our mission and vision up close. We do try to keep this at the center of everything we do with the GCPC. Our vision, real broad, Genesee County Prevention Coalition envisions a community free of mental health and substance use disorders. And our mission is the GCPC improves behavioral health through innovative strategies and our community partnerships to prevent mental health and substance use disorders impacting youth and adults in Genesee County. So we do try to keep that at the center of everything that we do. We keep that on our agendas, on everything, so it's very visible. Next slide, please. I think you all probably have your own different values, but we went through a recent strategic planning process, and this was an interesting portion for us. We really had to kind of re-identify, you know, what are our core values? It was a really great practice, and we got the core values to be identified, and we wanted them to be optimal health, community safety, data-informed innovation, self-empowerment, and inclusive partnerships we find very valuable. Next slide. And this is just a little bit more of kind of the techniques of what we do to get to our mission and vision and really some overarching goals of our strategic plan. We want to create and sustain a community prevention system within the county that incorporates a strategic prevention framework and providing leadership and collaborating efforts in mental health and SUD prevention in order to impact the primary behavioral health problems at the community level. It's a real broad goal there. To build resilience through effective prevention strategies and also to educate its members on current prevention planning concerns and bring awareness of the coalition and its efforts to the community at large. So that's some of the bigger goals that we are aiming for. I'm going to hand it over to Emily because she's going to dig into the toolkit a little bit more.
Perfect. Thank you so much, Carrie. So I just want to start by really giving a nod to Coalition and to Oceana Leads because they shared their toolkit, which is called Keep Out the Teen Room Project at the 2018 Coalition. And when we saw them present on this, we really wanted to do something like this in our community. And so we had conversations with them and got permission to use their toolkit as a starting place to create our toolkit. And so we really just want to thank them, and then also thank Coalition, because without this platform, we would never have had this opportunity. I also want to mention that we saw the tall cop, Jermaine Galloway, at the Keys to Addiction Conference in 2016. And when we went to the Coalition in 2018, we'd already been kind of having some thoughts after seeing the tall cop at that Keys conference. And so that had really kind of sparked something in us. And one thing that he impressed upon us was going out into our community and doing community scans, which I'll talk more about as we get more into the toolkit. But I also want to mention that he is a great resource. Since we saw him at the Keys conference, we've followed him on socials, and he has a really great, especially Facebook page. He does a great job of posting national information. And so I would recommend following him just because he does provide some great resources. So I wanted to mention that this started out as an initiative of our Underage Drinking Workgroup, but it quickly spread to our other work groups. And so I'm going to talk and cover a little bit on other substances too, but it did start out as an initiative of our Underage Drinking Workgroup. And then I just wanted to mention that once we decided to create this toolkit, it took us about 8 months, which felt like a really long time while we were doing it. We worked with a graphic designer to create the product. We gathered items, and I'm going to talk all about that as we go through this, but it took us a long time, but that time really helped us create a product that we're really proud of. So we've had the complete toolkit items and the booklet for about a year. So we've really just kind of gotten going on and really just scratched the surface on what we are going to be able to do with this project. So our toolkit has 2 main sections. The first section is designed to create awareness and empowerment for parents to identify youth use in the home. And then the second section is a resource guide, which provides a verified list of youth prevention, education, and treatment resources in our county and at the state and national levels. So I'm going to show you our kits, and then, so this is the full toolkit, and I think it's about 24 pages, and I'm going to get more into this, but this is what it kind of looks like. At the back is a resource guide. And then our second kit that we printed, so we decided to print 2 copies, is just the resource guide. And I'm going to get more into why we decided to print 2 copies. But I do want to mention, and I'll kind of say this a couple of times, but I wish we were all together. I wish we could all be together and I could hand each of you a copy of this today. Unfortunately, that's not the case. So if you're interested in getting a copy of this, email me directly and I'll work with you directly in getting you a copy. It is a large document, so we can't email it out to everybody because it confines the, goes beyond what email is capable of. So I will work directly with you to get that to you if you email me directly. It might take me a minute, but I'll get to you, I promise. Okay. So when we started this, we were working to create a toolkit for parents. And we had conversations in the beginning with our work group that we would maybe eventually do something for teachers or other community members. We weren't really sure what this was going to look like. But once we developed this product and we've started taking it out into our community, it's really become something that is good for the whole community and has really been a resource for us to get into different sectors of the community. So I just want to go through a few places that we've taken this to give you an idea of how you might be able to use this in your community. So we have taken it out to parent groups. So we received the Communities Talk Town Hall mini grant last fall. And so we hosted a town hall and we set up our toolkit in a bedroom scene. And the picture right here is us with this bedroom scene set up. And so that was a great opportunity. And that was focused on underage drinking. And we did have some focus on vaping at that event too. So then we also have taken this to parents of adolescents in recovery programs, at a recovery program in our community. We've done staff trainings. So a second adolescent recovery program in our community brought us out and we did a staff training for their staff to help them identify drug concerns in their housing. We've done this for school staff, and actually the first school staff training we did was a great opportunity for us. It was the first virtual presentation that we were able to do with our toolkit, and it was a good opportunity because it was set up prior to COVID, but it was for an academy that's located here in Flint. They have a second location in Lansing. So we were able to do a training for their staff in Lansing and their staff here at the same time. It was perfect. And that day we were able to train teachers and administrators at the same time, which was a great opportunity. We've taken this to other prevention professionals. So Kelly and I presented at the MCRUD meeting last fall, I think it was September or October. And then we took this to the Alliance of Coalitions for Healthy Communities, to their networking meeting last fall also, and then we're here today. So providing some technical assistance to other professionals has been a great opportunity too. We've been to other sectors of the community, including workers of early childhood home visitors at a lunch and learn in our county. And then we went out to a community housing fair that was actually located at a university in our county, but it was for the community. We've done virtual presentations and we've done in-person presentations. We have been able to set this up as a whole bedroom scene, as you can see in this bottom picture here. We've been able to set it up as a vendor table, as you can see in that top left picture. And then we've also broken the kit apart and taken substance specific pieces out. So the bottom picture here, I know it's hard to see, but we had just marijuana and vaping at that presentation. We've also been able to kind of break through and establish some new relationships with the school resource officer group in our county. And really this has been a great resource for them too. They've been very interested in having copies of this booklet. So far, we have limited our presentations to adults only, to parents only, to school staff only. And we know that eventually we may include youth in our presentations, either as part of our presentation or as participants. We just haven't really broached that yet. And partially it's because we want to make sure that we're really cautious if we do that, just being very cognizant that we don't want to be teaching youth anything that they don't know without making sure that we're providing lots of support on the back end, and that we're either available to answer questions for them if they have questions that come up after our presentations, or that they might have support. We want to make sure that that's available. So that's not something we've done yet, but we know that there are other organizations that do similar presentations like this that do involve youth, so we know it's something that we could do later on. Carrie, do you have any questions? Have any questions come up yet? Okay. I'll keep moving through them. So when we started this project, we really realized that we wanted to make sure that we were giving parents as much information on the front end as possible. And we wanted to recognize that it could be possible that a parent get a hold of our toolkit or resource guide, but not see our presentation. And so we wanted to include just a little bit of information to them from us. And so we came up with this letter, which took us a long time, but we came up with this letter that's in the front. It's the very first page of both kits. And so we really included this as a caution to parents. And the reason for that is because not all items in the kit are certain indicators of use. So some items are just household items that could indicate use, but aren't 100% indicators of use. And so we wanted to really just caution parents that if they find something in their child's backpack or bedroom, to not make assumptions. We wanted to remind parents and teachers and other staff members, really anybody who's working with a youth, really to be intentional about building relationships with that youth in their life, and then really to just be aware of changes in a youth. So they can be aware and know if something's going on, and then to be starting conversations. So we feel like this is a really important part of our kit. Okay, so this is what a sample page looks like of our toolkit, and I'm going to stop sharing in a minute, and I'm going to just go through a few items with you. So when we do our presentations, we make sure and tell whoever we're presenting that this is not an exclusive list of any item that could indicate drug or alcohol use. There's about 75 items in the kit. And some items have multiple uses, and so we just really want to encourage people to know that this isn't everything that's out there. We like to remind people that kids and users in general are creative, right? And that new ways to use or store drugs are constantly emerging on the drug scene. And so we really, really try to emphasize that. And then I always ask, especially when I'm talking with the police liaison group has been a great resource to me. But when I talk to teachers and to parents too, I always ask them to let me know if they hear of new things that aren't included in my kit so that I can include it in an update. So if any of you, if when I share this with you, if any of you have something that's not there, please share it with me so that we can update this. So I've been, especially when I've been doing virtual presentations, I've kind of had to break things into categories to kind of creatively cover everything that we have, just because I can't physically sit here and show every one of these items. It would take all day long. So I've kind of broken things into different areas like paraphernalia, and gone through some different paraphernalia items, stash containers, creative ways to use, favorable attitudes. I've also broken things apart into substance specific, so I can pull out all the things that have to do with alcohol or marijuana, tobacco, vaping, prescription, other drugs. And we've had requests like that. Sometimes when we go out, people will say, can you bring specifically, we're having a problem with alcohol in our school. Can you bring anything you have to do with alcohol? And I'll bring those things. So I'm gonna stop sharing so that hopefully I get a little bit bigger and you can see. I'm gonna take just a few minutes to go through a few items, and then if later on anybody wants me to cover any more, I'll take time to do that. So I'm gonna just go through a few things that I've found to be kind of interesting in past presentations. So I usually start with paraphernalia items just because it's high interest, and a lot of times people kind of get excited about it right off the bat. And I'm gonna talk in a minute too about where I got items and how I went about the process of gathering these things. And in the kit, as you saw on that sample page, it describes each item and maybe how it's used. So this is a bong that I bought at a local pipe shop, local head shop, and this is glass, but you can get like silicone or other materials. So I also have a small glass pipe. This is a one hitter. Okay, yep, I see Mike's asking what are some of the prices. That I did have that later on, but I'll say it now too. So every item in that I have in my kit was less, like around $20 or less. So there's actually only 2 items that were $20. The bong was about $20, and I have a t-shirt that was about $20. Everything else was less than that. And I'll talk a little, I'll try and mention where I got things as I go through. So the bong I bought at a local head shop, this pipe, and then this is a one hitter that could be used for dried marijuana or for wax. It has a removable piece on here that you can use for wax. When I bought this, I was told that the person who was helping me really liked this one because it was easy to clean. And it's also would be difficult to break. This was like $5. The pipe, the same, was about $5. Okay. Okay, so I have we own 3 different vaping devices, and these are really popular right now. So we have the Juul device with the charging port. This is a Soren Air, and this has a liquid fill here. And I like this one because to me it looks like a highlighter. It's also very easily concealed. And I have very small hands and I can easily conceal it. So a high schooler could very easily conceal that. This is a one hitter vape, or like single use vape. This is, I bought this at Spencer's in our mall, and I was carded when I bought this. It says, I love donuts on it, which is very appealing to youth, as you know. Our Bob Marley rolling paper, which also has favorable attitude with the Bob Marley on it. And this is really inexpensive. For Bob Marley, it was only $2. Okay, I've got, oh, this is another one hitter, and this is very easily concealed. Looks very much like a small screw or something. Would be really easy to just toss in the garbage, toss in the grass. Would be very difficult to find. This was only $3. This is a lighter. So what's interesting about this lighter, different than like another lighter, is that on the bottom I've painted some ash. And so this could indicate a marijuana use, because if somebody was smoking a pipe, or they could tap down and the bottom of their lighter would get ashy. Okay. So I also have a couple of like small things, and these came up when I purchased some things from Amazon. And when I started purchasing things from Amazon, other things started to generate in like your suggested purchases. So this was one of the things, and I'm not sure how well you're going to be able to see this. So it's a small, like gold looking vacuum cleaner. So it is actually like a small straw, and this could be used to snort cocaine, was what you would probably use this for. So I purchased that from Amazon. Okay, I'm gonna go through a few stash containers. Most of the stash containers I purchased from Amazon. And so the first one, this is my favorite partially because I'm a Coke drinker, and also because last fall I was at one of our school districts and I was in a meeting with the superintendent and the principal of the school and pastor from the community and like many community members, and it was a lunch meeting, and I had this sitting on my table because I was going to talk about my toolkit and how I could bring this out to them, so when it got to my turn to talk, I said, okay, I've got this Coke can here and it's actually a stash container that you could use to store drugs. And the superintendent of schools said to me, I thought you were really stuffy because you brought your own Coke and you were too good to drink our Coke. This sat in front of him for about an hour and he had no idea. It's weighted. I wish that I could pass this around the room and that you could feel it and feel that it's weighted. It feels just like a can of Coke. So you could put all sorts of different things in here. So I also have this that I purchased from Amazon, says Dasani. And again, I wish I could pass these around so that you could see the detail on it, down to dates, and literally everything on it looks real. It's got real water in it that really freezes if you accidentally leave it in your car in the winter. But you pull it apart and it's a stash container. So water bottles and other bottles like this can easily be made also. Crafted by a young person or really any user, but this one was purchased from Amazon. Okay, so here is my hairbrush, and the top just kind of untwists and hard to see, but there is a container there, which my coworker pointed out would also be a great place to store bobby pins. But this was something that I didn't originally intend on purchasing, but came up when I started purchasing other stash containers on Amazon. This came up as one of the suggested purchases. Okay, I've got a Sharpie marker that actually writes, but if you open it like this, there's a small opening. Sorry, I'm having trouble, I guess, realizing where my camera is. You could put marijuana in there, you could put pills in there. I've got a chapstick that's the same, opens up. This chapstick container, I hollowed out. It was my own personal chapstick. I hollowed it out, which again would be really cheap, no cost, right, for that. Watching the time here. Okay, I've got a few others here. This is a sunscreen that comes with a funnel. I always kind of joke that if I found a sunscreen in my kid's bedroom, I'd be more concerned and kind of tipped off that something was going on. So this would be really used for alcohol. This is maybe obvious, maybe not. It's like a bangle bracelet, but also comes with a funnel for alcohol. This I think is kind of common on like the concert scene and things like that. Sorry, I'm flying through this. I just want to give you a good idea of different, and really it's endless. Once you kind of get into this and start looking these up, like you could be here all day. Here's some speed stick that pops open again. This is another interesting one I didn't really intend on originally buying, but populated on Amazon. So it's a hidden wall safe. So it looks like an ordinary outlet, but would be a real trouble for, hiding things in a bedroom specifically. And then my last stash container that I'm gonna show you right now is my doob tubes. So they're smell proof. And it says right on the outside, hidden in plain sight. So the outside of the packaging says tampon right on it. So I always think when I am looking at these, I always think of going to like a Tigers game or something like that, where they kind of search through your purse. But the inside has this tube in it, which is smell proof. And it says right on the outside, though, smuggleYourBooze.com. And it just twists right off. Okay, so some other things that I want to show you today are another one of my kind of topics that I like to go through are favorable attitudes. And I really try to emphasize when I'm talking about favorable attitudes that this is something that might be a first indicator of a problem, because you might just notice that your child is wearing different clothing, or has something different is going on, but it also doesn't necessarily indicate that use is happening, right? So I always like to tell this story too of when my little sister was in elementary school, and she came home from school and said, "Mom, can you buy me the tennis shoes with the check mark on them?" She had no idea what Nike was. She had no idea anything. All she knew is these other people had tennis shoes with check marks on it, and she wanted to be cool like them. So she wanted the cool shoes with the check marks on it. And so sometimes you'll notice in your youth or in a kid in your classroom that something is different about maybe the clothing that they're wearing. And that might be a first indicator that something is going on. So this is my first thing that I've got. It's a garbage can. It says #wasted on it. So you know what that means. And I know that this was purchased from Meijer. So kind of sad to me a little bit. This obviously is marijuana, Bob Marley colors. This sack also has a stash compartment. There's a small opening right on the side there. Could easily stash something in there. This was purchased from Spencer's. This is my other $20 item here. My Snoopy is high shirt, or Scooby. I always say Snoopy. Scooby is high on my t-shirt here. This guy was from Spencer's also. I've got a journal, and this is in the book. And again, like I really just like to say that, I'm not encouraging parents to go through and read diaries or journals or anything like that, but just to be aware. And if a kid left something, out on the kitchen table with a sticker on the front that says weed is bad, we should burn it, maybe it's time to start the conversation, right? To just be aware of what's going on. And then my last little t-shirt I have here is, I'm not sure how well you're gonna be able to see this. Okay, it says, oh my goodness, it's wrinkly, Hakuna Moscato. And so, again, Moscato is a very adult. I wouldn't necessarily expect a youth to be drinking Moscato. But again, Hakuna Matata is a very youth-driven concept. And why do we need to have this messaging related to about an alcoholic product related to something that's so youth-driven?
Emily, I'd like to jump in with a question. It was a little bit earlier from Ben Ryan from Dickinson, Iron County. He asked, wax, what do you do with wax? Kelly did answer that it's, it's a high potency form of marijuana or with THC in it. Is there anything you'd want to add with like wax? What you were showing a device that you could use wax and you would burn it, right?
Yep, to smoke it.
Okay.
Yep.
Okay.
So, and if you need more information, we can help you find more information on that too. So,
okay, thank you.
I have one last thing here that I do want to show. So this is my last little thing that I got out to show you guys today. So this is a trumpet mouthpiece. And I always tell parents, if you've got a kid who's not in band, or you've got a woodwind kid, but you find this, maybe it's time to start a conversation, because if you Google how to make a bong using a trumpet mouthpiece, you're going to get a YouTube tutorial, and several actually. So things like that are just things to be aware of. Like, make sure you know your kid and know what's going on, right? Have a conversation, right? So, okay, I'm going to go ahead and start sharing and get back to our PowerPoint here. Okay, so I'm going to talk about a few lessons we learned as we went through this process, hopefully to help any of you who are interested in doing this. So as I mentioned, when I went through the different items, we gathered things locally and through online sources. And that Amazon piece was so amazing to me as I went through this, because really you can get literally anything on Amazon. And it was a little bit upsetting to me as I went through this, and my work group members and other staff members can attest to that, because it's so easy to have access to Amazon. Many kids probably have access to their parents' Amazon, and that's not something that's necessarily monitored, but also you can easily purchase an Amazon gift card that's then using cash, and then an Amazon package shows up, right? And so that was a little bit upsetting to me. And then Amazon also generates those suggestions and suggestions of further purchases and things like that. That was a little bit upsetting. So then we also shopped undercover, and this was really helpful to us to give us an idea of what our community looked like. And so by going into stores and having conversations with the workers there, it really gave us an idea of what our youth find when they go out into our community, what favorable attitudes exist when we went out into like party stores and gas stations, things like that. We knew where they could get different items. So that was really helpful to us. And I would really encourage anybody to do that, to just have an idea and know what your community looks like, so that you're aware of some of these hotspots, right? And then I wanted to mention too that as we started going out doing our in-person presentations, we discovered that it was really important to have several staff members with us. And part of that is because while not very much of our stuff is like very valuable independently, you know, adding up, it was worth a lot, and it was worth a lot to our coalition. We didn't want anything stolen, but also we had a lot of little items. So just to be aware of that, like we always make sure that if we don't have a second staff person that's able to go with us, we have a work group member or board member who's able to go out with us, just to help have an extra set of eyes on all this stuff that we have. It also really helps to load and unload, because this has gotten to be kind of a lot of stuff that we're carrying around. So many of the items were also donated by either local businesses or work group members. Our Salvation Army donated a lot of stuff for that bedroom scene piece of it, like just the everyday items. They donated some of those things for us. So the last thing that we kind of wanted to mention is that when we go out, we also were able to purchase some drug kits, some drug test kits. So we have alcohol and marijuana test kits that also a nod to Safe in Northern, who presented yesterday. They talked about that at the Coalition, I think last year, and we picked up that idea. So, and we were able to purchase some test kits. So this is an alcohol test kit, and we have a typed up parent note that we attached to it. And really this is just adding another protective factor, and that's free to anybody who wants it. And so we've been able to distribute a significant amount of those with this. Okay, I'm gonna go in and just go through our resource guide a little bit and talk about that. So we, when we put together our resource guide, we really just decided that after we finished that first section of the toolkit, we really just wanted something more, especially for parents who might be in a place of trauma. Who might come to our presentation and realize that their kid was maybe using, or maybe just realizing that there were some favorable attitudes towards drugs or alcohol, and that maybe they needed to start a conversation with their kid. So that's why we decided to put this resource guide together. So we included self-help resources such as local Alcoholics Anonymous and Al-Anon, DAM. We included some statewide resources and some national resources. And we're continuously editing and tracking so that we can update for our next printing, which we actually unfortunately have to do because one of our treatment providers did close this month. So we're tracking those things as we go through. So this is a sample page of our resource guide. And that piece of it, just being that, like, recognizing that if a parent was in a place of trauma, so if a parent either got a hold of this because their youth, they found out that their youth was using and they wanted to get them help, or if they came to our presentation and wanted to find help, we wanted to make it as easy as possible for them to use. So we really thought a lot about this, and we ended up we went ahead and put it together like this. We put GHS first because a lot of the other places are going to refer people back to GHS, but then it's alphabetical order. And we have a key at the bottom so that it can be really easy and parents can know whether a specific place is going to offer treatment services or if they offer prevention education services, or maybe they offer both. So we worked from a really large list of providers when we put together this resource guide. And we narrowed it down to providers that only service youth because this is specific for youth. And so I just kind of went a little bit undercover, I guess you could say. I started at the top of the list that I had, and I called every single prevention and treatment provider in our county. And I said to them, hey, listen, I am a parent. I've got a teenager. I think they're using. Can you help me? And I made sure that every single resource that I put into the guide was someplace that would accept youth, that had conversations with me, that were able to know how to help a kid when they came in. And some places I would stay on hold for 20 or 30 minutes to find out that they couldn't treat youth. And so it was amazing to me as I went through that process to learn how complicated that this system is in our county. And it was really eye-opening to me how difficult it must be for a parent who's already in a place of trauma, how difficult it must be for them if they're put in this situation. So that was really eye-opening. It was sad, it was frustrating, but I felt like at the end we have a really good product that we can offer to people. And then it was also great because it started to spark some conversation among some clinicians at our monthly coalition meeting, and just beginning the conversation about starting to remove these barriers. Nothing has really been completely accomplished yet, but we're moving in the right direction because we're starting those conversations. Okay, any other questions right now? Okay, so I'm gonna move on and then just keep questions coming if anything comes in. So specifically when we started presenting online, we felt like we really wanted to add in some more kind of wraparound pieces, but some more pieces that would add and like focus on hope and just teaching parents and other adults in young kids' lives the importance of fostering protective relationships. So that's what we've got, just a couple of resources here, and this is maybe something that you can include if you end up doing this, but these are just a couple that have been really helpful to us as we've gone through. So our first example we have is from Search Institute, and I know many people in our field know and love Search Institute for their 40 developmental assets. More recently, they've had some new data that's come out on the 5 elements of developmental relationships. And I really love this new stuff that they have. So they identify 5 developmental relationships as expressing care, challenging growth, providing support, sharing power, and expanding possibilities. And in their research, they've identified that in many settings across the nation, across many different sets of kids, that in many settings, 1 in 5 youth are reporting that they do not experience any of these developmental relationships. So in that, they have identified an interview that a parent or a teacher, a mentor, coach can do with a youth on the spot that identifies sparks, strengths, struggles, and supports in that young person's life. And this TED Talk, which unfortunately we don't have time to watch today, but this TED Talk is by the CEO of Search Institute, Dr. Kent Peckle. And in this, he does a really great job of kind of sharing a little bit of his story, but then going on to talk about those 5 developmental relationships and that sparks, that 4S survey. And I've used actually a portion of this. I've cut it down to like 4 or 5 minutes, depending on my audience, and embedded this right in my presentation. And I've gotten great feedback every single time that I've done it. On Search Institute's website, they also have a discussion that you could do on the whole 15-minute TED Talk with a larger group. And I know that the Holly Coalition did that earlier this spring with a larger group, and that was really very successful. So that's just another example of something that you could do. Okay, I'm gonna turn it over to Carrie.
Thanks, Emily. The next 2 slides, I mean, I know that most of you are probably all very familiar with ACEs, but it's really important to approach prevention with the concept of what ACEs are and how important they are. Just as a reminder, adverse childhood experiences is what ACEs stand for. And the next 2 resources are really, we felt that they looked good, the layout was good, it was easy to understand, and it really gave a sense of understanding to parents who may have never even heard of what ACEs are. And so it does a really quick job of describing what ACEs are, and basically those common, or those 16 identified ACEs from the Kaiser Permanente study are listed on here, and what exposure to those ACEs might do. I mean, we know that it might create some risky behaviors down the line, but it also can have some real permanent effects on chronic illnesses that someone might experience, like heart disease, liver disease, depression. So those are some things that we need to be concerned about. So we thought that this infographic did a nice job in, you know, what happens to kids when these ACEs occur, and how that might prolonged exposure to ACEs can create a toxic stress reaction, and we know what that can do to the brain. So we thought this was a really cool handout. And then the next slide actually talks about resilience. And so we talk about ACEs, and that alarms a lot of people. However, we do know that resilience really trumps ACEs. And so this is a nice kind of an overview of what does resilience look like, and what can you do as a parent to help build the resilient youth, and what it takes to be resilient parents. So it goes like step by step, and what helpful things they can do to help their kids beat some of these adverse experiences that they have had. So these are some really cool resources. This link here is also takes you to a lot of different cool resources as well. So, and then, yeah, and the next slide, please. I think this is kind of our final, we'd open it up for questions, and this is all of our contact information. Our staff are all listed there. Yeah, does anyone have any kind of questions? Oh, it looks like Barry Schmidt said SET is related to about 30% of those ACEs, right? So, true. That's why it's so important to include ACEs in our approach of prevention.
Yeah, it looks like we do have a question about the handouts. We'll go ahead and send that ACEs handout, and then I'll send that to Mike, and he can send it out to everybody. I'll send the link for the TED Talk also, which is on Search Institute's website, but I'll send the link directly.
And just a reminder, if people want a hard copy of that toolkit, if they would just email Emily, and we will get to those requests. We'll get them out.
What's your email again, Emily? I'll stick it back in the chat box.
Yeah, it's efinkle@thegcpc.org. I'll stick it in there. Thanks, Mike.
We have a few minutes if anybody has any questions. Just want to go back to how you selected the resources that went in the guide. You kind of covered it because you did something you did extensive background by calling everybody. So you called all the resources just to kind of see what the experience was. But are they all, I mean, Genesee County is a fairly large county, so I'm assuming there's a lot of services, but did you look at all like can you just cover that again? Did you look at all the licensed like treatment organizations and list them all, or only if you called them and they passed some kind of a internal kind of subjective test? Or, that always gets political about what do you put in, what do you don't put in, you know?
Right, yeah. So we had a couple of lists that we worked from. One was from GHS, and then one was from, what's the name of that other organization, Carrie?
I don't know who you're talking about.
It's okay. It's escaping me. But the participants aren't. None of. I don't think the participants
are on.
Anyway. So we had 2 guides that we started with, and in that there were some specific licensed professionals. So we called those specifically. There could be other independent professionals, but we started with that greater list.
Like
it's
region
the coalition
10.
you said on.
Oh, wait. For the region? For region 10?
No, the other.
Oh, Greater Flint Health Coalition.
Yeah, Greater Flint Health Coalition. Thank you. Escaping me. So we started with those lists, and then basically if they would service youth under the age of 18, I included them in my resource guide. And again, that is something that you would have to, you know, if you were going to do something like this, you would want to just set the standards for your organization and know like how many are in your county, your community. And then, like you said, Mike, you know, avoid that that political piece. There were places, like there was one organization that wanted into the book, but weren't offering resources to youth right now. And so we made the decision that we couldn't include them right now. But one thing that I didn't mention earlier is that we started with a really small printing, specifically because we wanted to have space to make edits as we went. And it turned out really good that we had started with a small printing because our in-person time has been limited, and so we haven't been handing out as many copies as we did before. But when we've done parent sessions, we've mailed a copy of the resource guide to every parent who sat through our presentation. But that is, that is part of it. It's, you would have to make those decisions for your organization.
We have another question from Kathy Geiger. She asks, how do you decide to limit information that might change knowing that you'll be printing this more than once?
So we just did our best to print the information that was accurate at the time. So on both ends, on that first toolkit part with the drug information, and then on the resource guide end too. So for example, flavored vapes is something that's in our guide right now. And obviously we know like now the flavor ban has come. So like we spoke about flavorings, and their appeal to youth in there, but that's something we may decide to change when we go to do an edit based on where we're at. So we had to make those decisions. And that's something that we can have conversations about. This is something that we would be really hesitant, especially the full guide with that information. It's something we would be really hesitant to hand out to anybody without having a conversation with them first. And so those are things that we can make edits and verbally walk through. And yeah, I agree, Mike. It is a big project, and it's tracking the changes is a lot of work, and it's something that is, does take a lot of attention to detail, as we want to keep up on the most up-to-date information.
Follow-up question, do you have a plan to distribute hard copies in certain ways and electric copies in other ways?
Right now, we don't have a plan to distribute electronic copies for a couple of reasons. One, like I mentioned earlier, it's too big of a document to email out. Another, we want to be really careful about not being the providers of information to youth. Again, it's not something that a youth can't Google on their own, say, or look up independently. But I don't want to know, I would not be able to sleep at night knowing that I was a person who was describing how to use a bong or something like that to a youth. So it's not something that right now we're distributing electronically. We've had conversations about eventually having it maybe like on our website with a key or something like that, where it's protected and like a user could go on and kind of look at. And then but right now we have the funding, and so we're able to print copies that we distribute. But the full guide, we're really careful about who we give it out to. I always have conversations before I give it out to somebody. And then the resource guide, we're more willing to hand out. I'll mention too, we had a lot of fun going out into our community and doing those community scans. So even if it's something that you're not able to put together a full kit, it is fun to kind of go out into your community and do those community scans. And then, it is fun and great to be able to start just with a few small items. So if you're able to purchase a few small items or get some donations for a few items, and then slowly grow it. And it's amazing once you kind of start looking how things kind of you start to see them more. And when you're out in your community, you might be more aware of them.
Any last question with the last remaining minute? Appreciate the presentation. Thank you for the information. You guys are doing good work there in Flint.
Thanks, Mike. Thank you.
You are welcome. Thank you again. I'm going to stop recording. There we go.